team starts its day with a 25-minute bus ride to the hospital. Watching out the window as the beautiful city of Quito passes by, we arrive at the hospital, now excited to do what we traveled a far distance to do. We unpack our equipment and begin to walk towards the hospital. Some grateful patients from years past greet us as we approach. We bring our equipment into the hospital and get dressed for our first day in the clinic. As the patients sit patiently to have a chance to be seen by the CAMTA doctors.
An adult orthopod and an adult nurse and a translator.
Okay.
And then they decide in there whether or not these people are going to be able to have surgery.
Okay.
If they are having surgery, they come out, this is our physio area, and so the physiotherapist will take them through what they're going to want them to do when they get out of surgery.
It's at this time the translators go hard at work, getting to know each and every patient.
The process, for those of you who don't know, is as follows. You all wait in your station. So there are stations for the pediatric orthopods, the adult orthopods, the physical therapists, the GPs. Most people know where they're going to be. If you don't know, then ask. Stay in your stations. One of us, a flow controller, either me or Matteo, will hand you a chart and bring you a patient. When you've done what you have to do with that patient, hand us the chart and hand us the patient, and we'll bring you another. Please don't freewheel and take a patient who's waiting thinking that you can get a job done. It'll cause the system to collapse.
Hello and welcome to the official kickoff of week 2 of CAMTA's mission to Quito, Ecuador. So today is Sunday, February 26th. We are kicking off our clinics. So as you can tell by the background noise, we have a whole whack of kids to see. Basically, you're having our pediatric orthopedic surgeons see them, see whether they're surgical candidates. We're seeing all sorts of things, clubfoots, hip dysplasias, cerebral palsy cases. So that's kind of the rundown of what's going down. And then over the next 5 days, we're going to be doing strictly operations.
This room is the pre-admission clinic for the patients who are having surgery this week. We will talk to each patient individually and decide if that person is in general good health and will benefit from the surgery. If somebody is too ill or too unwell to have the surgery, we have to decide that that person may have to wait till next year. Say they have a bad pneumonia or a bad strep throat or something, it's not good for them to have the surgery this year, so they might have to come back next year. Or if a person has some chronic medical problems such as severe heart disease or active tuberculosis, then we also have to have that treated, controlled first before they have the surgery, and sometimes we have to decide whether they will ever be able to have the surgery. We do a complete history and physical examination on each patient together with a registered nurse, and we basically help with the decision as far as who is going to have the surgery this year.
Este cuarto es la preparación donde pesamos, medimos
tomamos la presión arterial a los pacientes, es decir, los signos vitales para que luego puedan pasar a ser chequeados por los médicos.
So we're here, we're waiting for the patients to come from the different rooms, being analyzed by the doctors, and then we're going to help them fill out these sheets, and then they're going to go to the general doctor, the GP.
This is where we're seeing all of our new patients. They've been screened before coming here. We know that they all have arthritis in their hips. And basically what we're doing is to evaluate that arthritis, see whether or not they're good surgical candidates. If their health is good, their arthritis is advanced, then they usually are good surgical candidates. Occasionally we have to reject them if they have other problems, such as a lady we just saw who had advanced arthritis in her knees, a very short leg, and an infected hip, which really precludes her from us being able to properly look after her down here with just 1 week of evaluation.
Sí, me siento la verdad agradecida de corazón porque esta operación cuesta muchísimo acá y yo les agradezco porque nos dan la oportunidad de poder nuevamente hacer la vida activa normal.
What we try and do is show the patients what to expect after the surgery. So that involves walking with the walker for a day or two, and then we teach them how to use the crutches as well. That always makes it a little bit easier if they've had a chance to practice ahead of time. We're also going to be showing them some of the post-op exercises, both bed exercises and other exercises that they'll be expected to carry on at home once they've been discharged. In addition to that, we have made a video of how they can get in and out of the vehicle, so we'll be going through that with them. And last but not least, we'll teach them about the universal precautions of a hip replacement. So there's 3 movements that they're not allowed to do after surgery, and we try and educate them about those, because those 3 movements, if they do that, they run the risk of having a dislocation. So basically, we're just trying to teach them as much as we can, because after surgery, they're a little groggy, they're uncomfortable, and it makes it that much easier.
Yeah, our job here is to get the medical history of the patients so that we know what their past medical history is like, a bit of an idea of what their social situation is, as well as what medications they may be on. That way we can better plan their stay in the hospital, get them ready for their surgery.
Four-year-old Sheila, and she has a case of hip dysplasia. So if you can see on the x-ray, actually I guess we took it down, it's basically there's this socket mismatch. The way your hip works is you have your femur, which fills in this kind of ball and cup kind of fitting, and when you have hip dysplasia you don't have that proper fitting at all, and after a while your hip can actually completely come out and dislocate outside the socket. And so for these kids we do bring them to surgery once they're old enough, and hopefully help them walk a little bit better and move a little bit better.
So we've seen about 10 patients so far, and many of them, more this week, need surgery than in the previous week. So we have several children who need surgery to repair their dislocated hips, and several that need to have their club feet fixed.
The day went really well. We got all of our supplies unpacked in the OR, and had a little lunch, and have come down to the clinic just to see the last of the last 20 kids go through.
So the procedure is that the patients are admitted through this area, which is called data processing, data control, and we enter all of their data into our computer and give them a chart. This morning we expected to have 28 pediatric cases, but we actually have had over 60. And so we are still processing, and at this point we still have a waiting room full of children waiting to come in. The adults went quite smoothly, and we are finished with the adults, but we're still doing pediatrics.
First day at CAMTA was pretty exciting today. We were pretty busy, I think busier than everyone expected. And I had a role of essentially collating documents and sticking and stamping. Today it sounds like there's still quite a few to come through, so maybe a couple hours, maybe, hopefully less.
So we're looking at about 45 minutes away from finishing the day here. We've got 5 or 6 peds patients left, and day went really well. A couple complications came up. Things got a little bit hectic at one point, but we've got a great team in place, and we've all done this many times, so everyone knew which role to play, and we kept things running smoothly. We've got a full adult slate for the coming week, and the peds will be complete once we're done here in about 45 minutes or so. So we'll pack up our bags and head back to the hotel for pizza and beer in the lobby tonight.